We all know that vitamins are important, but why? Here's what you need to know about what's in your food, or your Flintstones chewables. Vitamins are organic compounds that are essential in very small amounts for supporting normal physiologic function. We need vitamins in our diets, because our bodies can't synthesize them quickly enough to meet our daily needs. Vitamins have three characteristics. They're natural components of foods, usually present in very small amounts. They're essential for normal physiologic function, e.g., growth, reproduction, etc. When absent from the diet, they will cause a specific deficiency. Vitamins are generally categorized as either fat-soluble or water-soluble depending on whether they dissolve best in either lipids or water. Vitamins and their derivatives often serve a variety of roles in the body, one of the most important being their roles as cofactors for enzymes, called coenzymes. Why is an adequate vitamin intake so important? 9 water-soluble vitamins. Vitamin B1, thiamine. Deficiency. Symptoms include burning feet, weakness in extremities, rapid heart rate, swelling, anorexia, nausea, fatigue, and gastrointestinal problems. Toxicity, none known. Sources: sunflower seeds, asparagus, lettuce, mushrooms, black beans, navy beans, lentils, spinach, peas, pinto beans, lima beans, eggplant, Brussels sprouts, tomatoes, tuna, whole wheat, soybeans. Vitamin B2, riboflavin. Deficiency. Symptoms include cracks, fissures and sores at corner of mouth and lips, dermatitis, conjunctivitis, photophobia, glossitis of tongue, anxiety, loss of appetite, and fatigue. Toxicity. Excess riboflavin may increase the risk of DNA strand breaks in the presence of chromium. High-dose riboflavin therapy will intensify urine color to a bright yellow, flavonuria, but this is harmless. Sources: almonds, soybeans, tempeh, mushrooms, spinach, whole wheat, yogurt, mackerel, eggs, liver. Vitamin B3, niacin. Deficiency. Symptoms include dermatitis, diarrhea, dementia, and stomatitis. Toxicity. Niacin from foods is not known to cause adverse effects. Supplemental nicotinic acid may cause flushing of skin, itching, impaired glucose tolerance and gastrointestinal upset. Intake of 750 mg per day for less than 3 months can cause liver cell damage. High-dose nicotinamide can cause nausea and liver toxicity. Sources: mushrooms, asparagus, peanuts, brown rice, corn, green leafy vegetables, sweet potato, lentil, barley, carrots, almonds, celery, turnips, peaches, chicken meat, tuna, salmon. Vitamin B5, pantothenic acid. Deficiency, very unlikely. Only in severe malnutrition may one notice tingling of feet. Toxicity, nausea, heartburn and diarrhea may be noticed with high-dose supplements. Sources: broccoli, lentils, split peas, avocado, whole wheat, mushrooms, sweet potato, sunflower seeds, cauliflower, green leafy vegetables, eggs, squash, strawberries, liver. Vitamin B6, pyridoxine. Deficiency. Symptoms include chelosis, glossitis, stomatitis, dermatitis, all similar to vitamin B2 deficiency, nervous system disorders, sleeplessness, confusion, nervousness, depression, irritability, interference with nerves that supply muscles and difficulties in movement of these muscles, and anemia. Prenatal deprivation results in mental retardation and blood disorders for the newborn. Toxicity. High doses of supplemental vitamin B6 may result in painful neurological symptoms. Sources: whole wheat, brown rice, green leafy vegetables, sunflower seeds, potato, garbanzo beans, banana, trout, spinach, tomatoes, avocado, walnuts, peanut butter, tuna, salmon, lima beans, bell peppers, chicken meat. Vitamin B9, folic acid. Folate is the naturally occurring form found in foods. Folic acid is the synthetic form used in commercially available supplements and fortified foods. Inadequate folate status is associated with neural tube defects and some cancers. Deficiency. One may notice anemia, macrocytic, megaloblastic, sprue, leukopenia, thrombocytopenia, weakness, weight loss, cracking and redness of tongue and mouth, and diarrhea. In pregnancy there is a risk of low birth weight and preterm delivery. Toxicity. None from food. Keep in mind that vitamin B12 and folic acid deficiency can both result in megaloblastic anemia. Large doses of folic acid given to an individual with an undiagnosed vitamin B12 deficiency could correct megaloblastic anemia without correcting the underlying vitamin B12 deficiency. Sources: green leafy vegetables, asparagus, broccoli, Brussels sprouts, citrus fruits, black-eyed peas, spinach, great northern beans, whole grains, baked beans, green peas, avocado, peanuts, lettuce, tomato juice, banana, papaya, organ meats. Vitamin B12, cobalamin. Vitamin B12 must combine with intrinsic factor before it's absorbed into the bloodstream. We can store a year's worth of this vitamin, but it should still be consumed regularly. B12 is a product of bacterial fermentation, which is why it's not present in higher-order plant foods. Deficiency: symptoms include pernicious anemia, neurological problems and sprue. Toxicity: none known from supplements or food. Only a small amount is absorbed via the oral route, thus the potential for toxicity is low. Sources: fortified cereals, liver, trout, salmon, tuna, haddock, egg. Vitamin H, biotin. Deficiency: very rare in humans. Keep in mind that consuming raw egg whites over a long period of time can cause biotin deficiency. Egg whites contain the protein avidin, which binds to biotin and prevents its absorption. Toxicity: not known to be toxic. Sources: green leafy vegetables, most nuts, whole grain breads, avocado, raspberries, cauliflower, carrots, papaya, banana, salmon, eggs. Vitamin C, ascorbic acid. Deficiency: symptoms include bruising, gum infections, lethargy, dental cavities, tissue swelling, dry hair and skin, bleeding gums, dry eyes, hair loss, joint pain, pitting edema, anemia, delayed wound healing, and bone fragility. Long-term deficiency results in scurvy. Toxicity: possible problems with very large vitamin C doses including kidney stones, rebound scurvy, increased oxidative stress, excess iron absorption, vitamin B12 deficiency, and erosion of dental enamel. Up to 10 grams per day is safe based on most data. 2 grams or more per day can cause diarrhea. Sources: guava, bell pepper, kiwi, orange, grapefruit, strawberries, Brussels sprouts, cantaloupe, papaya, broccoli, sweet potato, pineapple, cauliflower, kale, lemon juice. Parsley. Vitamin deficiencies can create or exacerbate chronic health conditions. 4 fat-soluble vitamins. Vitamin A, retinoids. Carotenoids that can be converted by the body into retinol are referred to as provitamin A carotenoids. Deficiency: one may notice difficulty seeing in dim light and rough, dry skin. Toxicity: hypervitaminosis A is caused by consuming excessive amounts of preformed vitamin A, not the plant carotenoids. Preformed vitamin A is rapidly absorbed and slowly cleared from the body. Nausea, headache, fatigue, loss of appetite, dizziness, and dry skin can result. Excess intake while pregnant can cause birth defects. Sources: carrots, sweet potato, pumpkin, green leafy vegetables, squash, cantaloupe, bell pepper, Chinese cabbage, beef, eggs, peaches. Vitamin D, calciferol, 1,25-dihydroxy vitamin D. Cholecalciferol equals vitamin D3 equals animal version, ergo calciferol equals vitamin D2 equals plant version. Deficiency: in children a vitamin D deficiency can result in rickets, deformed bones, retarded growth, and soft teeth. In adults a vitamin D deficiency can result in osteomalacia, softened bones, spontaneous fractures, and tooth decay. Those at risk for deficiency include infants, elderly, dark-skinned individuals, those with minimal sun exposure, fat malabsorption syndromes, inflammatory bowel diseases, kidney failure, and seizure disorders. Toxicity: hypervitaminosis D is not a result of sun exposure but from chronic supplementation. Excessive supplement use will elevate blood calcium levels and cause loss of appetite, nausea, vomiting, excessive thirst, excessive urination, itching, muscle weakness, joint pain and disorientation. Calcification of soft tissues can also occur. Sources: sunlight, fortified foods, mushrooms, salmon, mackerel, sardines, tuna, eggs. Vitamin E, tocopherol. Deficiency: only noticed in those with severe malnutrition. However, suboptimal intake of vitamin E is relatively common. Toxicity: minimal side effects have been noted in adults taking supplements in doses less than 2,000 mg per day. There is a potential for impaired blood clotting. Infants are more vulnerable. Sources: green leafy vegetables, almonds, sunflower seeds, olives, blueberries, most nuts, most seeds, tomatoes, avocado. Vitamin K. Deficiency, tendency to bleed or hemorrhage and anemia. Toxicity, may interfere with glutathione. No known toxicity with high doses. Sources: broccoli, green leafy vegetables, parsley, watercress, asparagus, Brussels sprouts, green beans, green peas, carrots. Vitamin solubility and absorption. Fat-soluble vitamins are mostly absorbed passively and must be transported with dietary fat. These vitamins are usually found in the portion of the cell which contains fat, including membranes, lipid droplets, etc. We tend to excrete fat-soluble vitamins via feces, but we can also store them in fatty tissues. If we don't eat enough dietary fat, we don't properly absorb these vitamins. A very low-fat diet can lead to deficiencies of fat-soluble vitamins. Water-soluble vitamins are absorbed by both passive and active mechanisms. Their transport in the body relies on molecular carriers. Water-soluble vitamins are not stored in high amounts within the body and are excreted in the urine along with their breakdown products. Extra credit: a plant-based diet generally has a higher content of folic acid, vitamins C and E, potassium, and magnesium. It generally has a lower content of vitamins B12, D, calcium and iron. Vitamin A is present in tears. Vitamins necessary for energy-releasing processes: vitamin B1, B2, B3, B5, B6, biotin. Vitamins necessary for red blood cell synthesis: vitamin B9, B6, B12. In some studies, supplementation with the mineral chromium has reduced total serum cholesterol, triglycerides and apolipoprotein B and increased HDL cholesterol. The discovery of vitamins started the field of nutrition. Earlier names for riboflavin, vitamin B2, were lactoflavin, ovoflavin, hepatoflavin and verdiflavin, indicating the sources: milk, eggs, liver and plants from which the vitamin was first isolated. Prenatal multivitamin, mineral supplements are associated with a reduced risk of low birth weight infants and with improved birth weight when compared with iron folic acid supplements. In observational studies, case control or cohort design, people with high intake of antioxidant vitamins by regular diet typically have a lower risk of heart attack and stroke than people who don't consume enough. Fat-soluble vitamins are mostly absorbed passively and must be transported with dietary fat. These vitamins are usually found in the portion of the cell which contains fat, including membranes, lipid droplets, etc. We tend to excrete fat-soluble vitamins via feces, but we can also store them in fatty tissues. If we don't eat enough dietary fat, we don't properly absorb these vitamins. A very low-fat diet can lead to deficiencies of fat-soluble vitamins. Water-soluble vitamins are absorbed by both passive and active mechanisms. Their transport in the body relies on molecular carriers. Water-soluble vitamins are not stored in high amounts within the body and are excreted in the urine along with their breakdown products.